Welcome! The Medical Outreach Alliance at the Down Syndrome Connection of the Bay Area has put together this presentation to discuss delivering a Down syndrome diagnosis. Our goals for this presentation are to assist healthcare professionals in delivering an informative and supportive diagnosis experience for families, to understand supportive, informative ways to discuss Down syndrome with families, and lastly, to inform about local and national resources available to support and enhance the lives of people with Down syndrome. In order to deliver a diagnosis, there must be testing and diagnostics performed. Let's first talk about what those are and why they might be performed. There are different reasons for testing, and these tests can help a family make decisions. It can provide reassurance in some cases or an opportunity to plan for the baby's care in advance. Some families may ultimately choose to terminate or pursue adoption based on this information. So what kind of tests are there and what level of risk is involved? Prenatal screening can identify whether it's more or less likely for certain birth defects to be present. Often performed by non-invasive testing like blood tests, ultrasounds, and prenatal cell-free DNA screening. The screening isn't perfect, and inaccurate results can vary from test to test. Screening gives a numeric risk assessment, not a positive or negative. Common screens include Harmony and Maternity 21. Performing these tests have no risk to the pregnancy. Diagnostic testing is more invasive testing, and it does carry certain risks that could affect the pregnancy, but they do deliver definitive diagnosis. Such tests are chorionic villus sampling, CVS, or amniocentesis. If a prenatal screening test indicates a positive result, then diagnostic testing would be needed for a definitive diagnosis. It's important for families to understand the differences between prenatal screenings versus diagnostic testing so they are able to make informed decisions. Popular prenatal tests such as Harmony and Maternity 21 are screens, not definitive tests. Results are not 100% accurate, and there still may be delivery room surprises without pursuing diagnostic testing after a screen. When receiving unexpected news, it's important for the families to also have access to and receive current and up-to-date information as soon as possible. Specific to Down syndrome, advancements in medical care, early intervention, and inclusion have improved outcomes significantly. Diagnosis can happen prenatally, at birth, or occasionally several months later. Some things to remember when delivering the news. Every parent will react differently. Take care with your words. While the news may be unexpected, how the news is delivered will forever impact the family. This is often referred to as a flashbulb memory, one that parents will remember with perfect clarity for many years. Let the families determine how they feel about the news and be prepared to be supportive. Some families will need time to grieve what was expected, which is normal. Give parents time to receive and process the information. Answer their questions honestly and knowledgeably. It's helpful and recommended that the healthcare provider delivering the diagnosis be knowledgeable about Down syndrome, as well as understand the importance of a sensitive delivery of the diagnosis itself. If you don't know an answer, tell the parent you'll find out. You can contact us and we'd be happy to help you. It's a good idea to discuss expectations in the short term as well, as opposed to a long list of potential outcomes that may or may not be realized, as the families are still processing the information. And if you haven't already, remember to congratulate the family on their baby. The birth of a baby is a happy occasion, and every baby deserves to be celebrated. Studies done on the experiences for families when receiving a Down syndrome diagnosis tell us this. Patients prefer to receive the diagnosis from a physician in conjunction with specialists and as soon as possible after the diagnostic testing. Be sure to set up a follow-up appointment, including any meetings with specialists if applicable. Both parents should be present, and preferably at a pre-designated time, either in person or by phone. Use neutral language and sensitivity when discussing the news. It's more broadly supportive to use such terms as "I have the results" or "I have unexpected news" instead of "I have bad news," which that really could indicate a potential bias and would frame the conversation to be a negative one. And again, don't forget to congratulate the family. Every baby deserves to be celebrated. Families want and need up-to-date information on Down syndrome. Connect them with local support and resources. It's helpful to have printed handouts, and we're ready and happy to provide you with this material to keep on hand. Delivering an unexpected diagnosis does not have to be a negative experience for families. By taking into consideration the feedback from these very families, it can be a supportive and informative experience, allowing the families to process the information on their own terms and not the way they might have been made to feel about that information because of the way it was delivered. Down syndrome today looks very different than it did just 40 years ago. As recently as 1983, the average lifespan of a person with Down syndrome was 25 years old. Today, thanks to medical treatments and advancements, as well as changing attitudes about inclusion, the average lifespan for a person with Down syndrome is about 60 to 65 years old. A common myth is that a child with Down syndrome will have a negative effect on his parents and/or siblings. However, studies indicate 99% of parents reported loving their child with Down syndrome, and the divorce rate in families who have a child with Down syndrome is actually lower than in families with a non-disabled child. 97% of siblings reported being proud of their sibling with Down syndrome, and 88% of siblings reported that they think they're better people for having a sibling with Down syndrome. Every person with Down syndrome has unique cognitive, social, and physical abilities, as well as unique behavior and accomplishments. There are no predetermined outcomes just because they have Down syndrome. Same as with any person without Down syndrome. More and more children with Down syndrome are becoming fully included in school, therefore enhancing their success and opportunities. Adults with Down syndrome can have relationships and marry, attend post-secondary schools, live semi-independently or independently, work at rewarding jobs, actively participate in their community. Each person with Down syndrome is unique, and there's no way to know what the future holds. The Down Syndrome Connection of the Bay Area has been local support for the greater Bay Area Down syndrome community since 1998. We established our Medical Outreach Alliance to support the medical community, which in turn supports our members. We keep our materials up to date and have handouts available to share with our medical community. We have printed references and recommendations available to help deliver a diagnosis, and we are available to meet with you to discuss supporting families with a Down syndrome diagnosis, either individually or as a group meeting. In addition, for families, we also offer printed materials with information about Down syndrome and resources in both English and Spanish. We can provide these to you as well to have on hand and share with families at the time of diagnosis. We have confidential trained support for new and expected parents in both English and Spanish, and we work to connect and support families based on their specific needs and where they are in the journey at that time. We have many opportunities for support, including but not limited to the Down Syndrome Education Alliance, our Expression Connection and Communication Readiness programs, peer development classes, our Medical Outreach Alliance, and much more. In addition to our local organization, there are also national organizations with various programs and supports designed for medical professionals and the families that they serve in the Down syndrome community. I encourage you to visit these websites as well. Thank you for listening to our presentation. Please don't hesitate to contact us if you would like more information or if you need any materials or handouts for your families. You can reach us at www.dscba.org or by email at medicaloutreach@dscba.org. Thank you for supporting the Down syndrome community.